Chronic joint pain caused by diseases like arthritis affects millions of people in the world every year. Therefore, effective guidelines for diagnostic purposes and treatment is essential. Firstly, you should know that joint pain is pain involving one or more joints, which may extend to muscles. Secondly, you should be aware of all such aggravating factors which makes joint pain worse, including exercise, movement of the joint, injury. In the next phase, you should be aware of all such factors that are helpful in relieving pain, like rest. Now there are some important questions that you need to ask your patient before making a diagnosis. You will ask the patient what symptoms they are experiencing with shoulder or left arm pain, including chest pain, muscle pain, pain in other joints, pain spreading to other joints. You will ask your patient if they, or anyone in their family, have had any of these conditions like diabetes, high blood pressure, heart disease, past shoulder dislocations, or episodes of bursitis. You will ask the patient what symptoms they are experiencing with hip pain, including ability to walk, low back pain, muscle pain, pain in other joints, pain spreading to other joints. You will ask your patient if they or anyone in their family have had any of these conditions: sickle cell disease, past surgery on or near hip. You will ask the patient what symptoms they are experiencing with knee pain, including muscle pain, pain in other joints, pain spreading to other joints, pain on squatting or running up and down stairs, feeling of snapping, catching, or buckling. You will ask your patient if they or anyone in their family have had any of these conditions: hemophilia, past knee injury or surgery. You will ask the patient what symptoms they are experiencing with calf or leg pain, including muscle pain, pain in other joints, pain spreading to other joints, calf swelling or tenderness, low back pain, pain worsened by coughing. You will ask your patient if they or anyone in their family have had any of these conditions like heart disease, chronic lung disease, recent surgery, or prolonged immobilization, thrombophlebitis. Now we will discuss general joint pain. You will ask the patient what symptoms they are experiencing, including muscle pain, pain in other joints, pain spreading to other joints, fever, stiffness of joints in the morning, skin lesions, back pain, cough, runny nose, diarrhea, headache, finger pain, and discoloration in the cold. You will ask your patient if they or anyone in their family have had any of these conditions like rheumatoid arthritis, gout, gonorrhea, past trauma or surgery to painful area, rheumatic fever, or genital discharge. You will ask the patient if they are taking any medications, and if their pain gets worse at the end of the day, or if they feel especially stiff in the morning, and if so, for how long. You will ask the patient how long their pain has occurred, and if they are recently exposed to deer ticks or strep throat. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. For pain in arms or legs, you will be checking for swelling, tenderness, deformity, discoloration or warmth, range of motion. For knee pain, you will check the range of motion in the hips, knee tenderness, knee joint stability, and a series of tests to check knee function. For shoulder pain, you will be looking for tenderness, a series of tests to try to pinpoint the source of pain. For calf pain, check for tenderness, calf size differences, skin, and pulse. For leg pain, you will be checking range of motion in hips, pulse, a series of exercises to try to pinpoint the cause of pain. Now, what can cause joint pain and what is typical for each cause? Well, there are different causes of joint pain in different regions. First, we will discuss causes of general joint pain. Now, if the patient has persistent pain in one or more joints, seldom in wrists or elbows or shoulders, and occurs more commonly in people over 40, then this might give you an indication that the patient has osteoarthritis? Well, osteoarthritis is joint inflammation associated with aging. But if your patient has typical symptoms like joint pain associated with flu-like symptoms, pain often disappears within a few minutes, then this might be an indication to virus. Means joint pain associated with a viral infection, such as the common cold. And what if your patient is having pain in at least one joint? History of infection with the bacteria that cause gonorrhea. History of discharge from the vagina or urethra. Fever. Skin rashes. Warmth and tenderness in joints. Then, these symptoms might be caused by post-infectious arthritis, which is in fact a joint pain occurring after some type of bacterial infection, and if back pain is accompanied by warm and red joints, tender and swollen joints, pain in at least one joint. Family history of gout tends to occur in big toe, then gout might be a reason to this. Well, this is characterized as joint pain caused by abnormal breakdown of substances by the body. Now, if the patient has morning joint stiffness, joint pain lasts more than 6 weeks, and has pain on motion, then this might give you an indication that patient has rheumatoid arthritis, which is defined as a disease in which the body attacks itself, causing joint problems. Now, if the patient has warm and swollen bull's-eye rash, spreading rash that occurs only in people living in or traveling to areas in which ticks are endemic, then this might give you an indication that patient has Lyme disease. Well, Lyme disease is inflammatory disease transmitted by tick bites. Now, if the patient shows symptoms like finger pain, discoloration in the cold, persistent skin rashes, then this might give you an indication that patient has connective tissue disease, which is a major type of body tissue. Now we will discuss causes of bone pain. Now, if the patient has joint pain occurring after injury, tenderness, swelling, inability to move affected limb, then this might give you an indication that patient has fracture or dislocation. Well, fracture or dislocation is a break or displacement of the bone. What if your patient is having fever, limp, bone tenderness, warmth in overlying skin? Then these symptoms might be caused by osteomyelitis, which is a bone infection. Now we are going to discuss knee pain in adults and children. If your patient is having knee buckling and locking of knee at a 30-degree angle, then these symptoms might be caused by meniscus or ligament tear, which is in fact the tears to the tissues that help cushion bones and connect them to muscles. What if your patient is having knee pain along with hip pain and has hip movement problems? Then, these symptoms might be caused by referred pain from hips, which is actually a hip pain that is felt in the knee. What if your patient has knee pain along with burning or tightening in the knee after running? Then these symptoms might be caused by iliotibial band, which is a state of thickening of the tissue around the knee. What if your patient is having heavy bleeding after minor injury, family history of bleeding, and swollen joints? Then these symptoms might be caused by hemophilia, which is a hereditary disease in which the blood cannot form clots. Now, if your patient is having pain on squatting, then these symptoms might be caused by Osgood-Schlatter disease, which is a painful swelling in a region of the lower leg bone. But what if your patient is having pain when ascending or descending stairs? Then these symptoms might be caused by chondromalacia patella, which is a softening of the cartilage in front of kneecap. Now we will discuss causes of hip pain. So, if your patient has hip pain causing limping that occurs after age 50, then these symptoms might be caused by osteoarthritis, which is a joint problems that develop with advancing age. Now the hip pain that occurs only in children, along with knee pain and limping. Then this might be caused by Pur's disease, which is a deterioration of bone in the hip. Now the hip pain that occurs at any age is more common in people taking adrenal steroids or those with sickle cell disease. Then this might be caused by necrosis of hip, which is a death of portions of the hip bone. Now we will discuss causes of shoulder pain. So, if your patient is having pain when moving shoulder, particularly when combing hair or lifting objects, then these symptoms might be caused by bursitis, which is an inflammation of the lubricating sac near a shoulder joint. Now, if your patient is having ache in upper arm or shoulder, and certain neck positions worsen pain, then these symptoms might be caused by referred pain from neck, which is a neck pain that radiates to the shoulder. What if your patient is having chest and arm pain, and is caused by exertion and relieved by rest or nitroglycerin? Then these symptoms might be caused by angina, which is a sudden spasms of chest pain caused by lack of oxygen to the heart muscles. Now we will discuss causes of calf or leg pain with numbness or tingling. So if your patient is having low back pain, leg pain or numbness, and the pain worsens with coughing, then these symptoms might be caused by sciatica, which is a back pain that travels along a nerve into the buttocks, legs, and hips. But what if your patient is having cramps, fatigue with exercise, pain relieved by rest, and associated heart disease? Then these symptoms might be caused by chronic claudication, which is a calf pain caused by an inadequate blood supply. Now, if your patient is having sudden pain, eventually leading to tingling sensations on skin or paralysis, and is more common in people with a history of heart disease, then these symptoms might be caused by acute embolus, which is a blockage in the blood vessels feeding the legs. Now we will discuss causes of blood vessel diseases. What if your patient is having aching, tenderness, leg swelling, occasional chest pain, or trouble breathing or coughing up blood? Then these symptoms might be caused by venous thrombosis, which is a blockage of a blood vessel by a clot. And lastly, if the patient has chronic aching or heaviness in legs, elevating the leg relieves pain, and brown discoloration of skin, then this might be an indication that patient has venous insufficiency, which is defined as lack of blood flow from a limb that causes blood to pool. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required.